And I don't think I can record on your meeting.
Yeah, I got it. So we just started. Okay, well, we're going to get started. First of all, my name is Kim and I am a nurse. So we are going to do CPR and making sure that we specifically cover some eye injuries and burns, since you are working with skin in the face. The Zoom etiquette is up there. I'm sure you're all familiar with this. I am going to mute everyone, but you can unmute if you have a question. And I also pause after each section and ask if anybody has questions. You can speak then. And also we have a chat box. If you have anything you want to ask in there, I can also check back in there. So please feel free to ask questions. Oh, hold on. Let's go back to the beginning. There we go. All right, so you're going to see a couple company names on here. I work with the Disc Foundation, and my name is Kim. I live right outside Washington, DC, so it's been a very busy weeker here too. We're hoping it calms down. And I work with the Disc Foundation, so they sponsor all of this training. And what we do is provide free healthcare education to anyone who asks for it. So if you need to get this for free for any group that you're in, the foundation is providing that for you. So we work with the Save a Life initiative, which is very active internationally. And I'll show you our website at the end and give you a code so that if you do want to get the CPR certification, you can go on the website and go through the course, do the quiz, and then you will be CPR certified. And the certification is good for 2 years, and it is nationally, internationally recognized. We are an accredited organization, and we are teaching the same information that the Red Cross and the American Heart Association are covering. So it's all very current. And our goal is to empower 10 million people to learn CPR. So if you've never done it before, we're hoping that you can pick it up, and maybe this is a refresher for you. So why do we learn CPR? If you aren't sure, the statistics are here that in the United States, we had about 300,000 people that have a cardiac arrest outside of a hospital situation, and the survival rate is only around 10%. So that's 1 in 10 people that would collapse and need CPR will live through that situation. So that's very low. In the hospital, it's a little bit higher. It was around 19%. So that's about 2 in 10 people. And studies are showing that definitely if we start CPR that and get that going until the advanced help arrives, that can double or triple their chance of survival. So we are working along with the American Heart Association with the same goal to really increase that rate so that people have more of a chance of survival. And people are, of course, afraid to try CPR. If you're not a medical provider and somebody collapses in front of you, it is very scary. A common fear now, of course, is disease with COVID-19, and studies have been done in the past few months and are showing that there really is not any higher transmission amongst first responders than there would be in the general community. So, we suggest wearing your protective equipment if you have PPE or gloves, mask, all that to protect you. That should protect you from any bodily fluids or bloodborne pathogens that are present, any viruses. Liability is also another fear. And again, in the United States and several other countries, I've seen that they also have a similar law. We have the Good Samaritan law, which protects anyone who attempts CPR or even just helping first aid. If you see an accident or you stop on the side of the road or you help someone. So this protects you from being sued and being liable for any injuries that would happen. The key there is that you are to only attempt things to the level of your ability or certification. So you can't try to do surgery that you saw on TV if you're not a doctor. But if you have taken CPR and you try it, even if you don't do it that well or it's not successful, you would be covered under this law that's in the United States. If you're unsure of your skills, we're hoping that you will practice and take our course and look at our online information that we have. And if you're afraid that you might hurt someone, we have to remember that somebody in cardiac arrest is not going to live. If we do nothing, they will die. So you can break a rib. People have heard about that, and it does happen. That's part of CPR. It's not going to happen every time, but the person, if they are able to survive through this situation, would be okay with having a broken rib versus not making it through their cardiac arrest. If the scene is unsafe, we do want you to look around and make sure everything's okay. We don't recommend running into help someone if it's not safe. So we're not going to jump in a freezing lake to grab someone if you're not trained for that. So we don't want you to become another victim. But if you look around and excuse me, you don't see anything, by all means, we encourage you to move ahead with that. So looking at our adult chain of survival, we're responsible for these first few parts here: the immediate recognition of cardiac arrest and activating our EMS system, which is calling 911. If you are in a school or workplace, they might have their own, code system, like you have to dial 0 on the phone or alert a supervisor or something like that. So make sure you know what that system is for wherever you are. And we want you to start CPR right away. And we're starting with chest compression. So that's the most important thing to remember. If there's an AED available to do defibrillation, then you want to grab that if it's around, or tell someone to go get it. The next 3 in this chain of survival are the responsibility of our healthcare providers. So the paramedics that come in the ambulance to give advanced life support, take them to the ER, maybe the cath lab, and cardiac rehab after that. So our main goals are to recognize an emergency, calling 911, and starting CPR and using an AED if you have one. And if you're not sure and you haven't ever figured this out, here is cardiopulmonary resuscitation. So cardio being heart and pulmonary being lung. We are going to combine our efforts here to provide rescue breathing and chest compressions, which are literally going to pump the heart ourselves when it's not working correctly. So we are actually pushing down on that bone right in the center of the chest. That bone is actually squeezing the heart, okay, kind of like an accordion. It's going to push that blood out. The blood already has oxygen in it from when they were breathing last, and it will push that oxygen around to the brain for them. When we do rescue breaths, we are adding a little bit of oxygen, not a lot. Our room air is 21% oxygen. So if I was to breathe out of my mouth, that's not going to be 100% oxygen, and it's not even the 20% in the air because it's already gone through my lungs. So it's down to 17% oxygen if I'm going to blow that through a mask for mouth-to-mouth rescue breaths. So it's a little bit of oxygen, and that's why the chest compressions is the most important thing. The sooner we start, the better. Every minute that we delay with chest compressions or an AED really reduces that survival rate down by 10%. And you only have a few minutes there until brain damage starts. And if it's been 10 minutes where nothing has happened, that is almost certainly not survivable. So our point here is don't delay and just jump right in and see what you can do. So we're going to overview the whole scenario, and then we will watch some videos here so that you can see how it all works. And hopefully with repetition, you'll be able to remember this. So we're down to just a few steps. The most important, of course, is that looking around. Is it a safe scene? And by that, we're saying if we're inside and you hear somebody yell or you find somebody unconscious, we need to look around and see, did something fall on them? Is there an electrical problem? Is there a fire? Was there violence? Is there a weapon nearby or a violent person? So we do have to kind of check all that in a few seconds. If you're outside, maybe like a car accident or something, we want to rush right in, but you do need to watch for fluids that would be leaking out of the car. There's a possibility of fire, explosion. I've stopped at accidents that to help and they're fine, but the car had hit a telephone pole and the telephone pole was, or electrical pole, I don't know what it was straight up, but then 5 minutes later it fell over. So you have to continually watch for a safe scene when you are responding to an emergency. So the first step we're going to do is really tap hard on their shoulder. We're trying to get them to move around and respond to pain and say, hey, are you okay? So really be loud. If you know their name, yell their name and see if they're okay. If there's any response, they move, mumble, their eyes move, anything, even if they're still unconscious, we don't have to do CPR, okay, because they're not in cardiac arrest. And if they're moving, then they're breathing. So then you can call 911 and just sit with them to make sure that they are still breathing while you're waiting for help. So if not, if there's no response, you're gonna call 911 and get an AED. So if there's one nearby, you can grab it if you're in a building and you know it's in the next room. If not, you need to tell a person that's nearby you to go get it. Say go in the lobby, go in the employee lounge, grab the AED, bring it back to me. And even if you're outside and maybe you're near some businesses or a community center, most often you're going to find one nearby. So you could say, we're out in a field, but hey, go in that building over there and see if they have an AED in the lobby. Generally, they are out like fire extinguishers now, just right in the lobby in the glass cases or right near like an information center or employee area. So then we're going to check and see if they are breathing. That's where you get down and see if they're breathing. If there was no response, you just really want to make sure, are they sleeping? Did they overdose? Are they having a seizure or diabetic emergency? Like, can you tell if there's any breathing? If you can't tell, or it's abnormal, like it's one breath a minute, that's not enough to sustain life. So we are just going to go with chest compressions right away. It is okay to do chest compressions if the person is technically alive. If their heart is not beating fast enough and they're not breathing fast enough, they are going to quickly go into cardiac arrest. So it's okay to start that ahead of time. So we do 30 chest compressions and 2 rescue breaths for adults. And we are going to go through the procedure for these in a minute. You're going to continue at that rate until either the AED shows up and you need to take a second to turn it on and put the pads on, or somebody else comes and you can take turns. There's my cat, excuse me. And also if your advanced help arrives, your ambulance, your paramedics, or somebody says, I'm a nurse, I'm a doctor. Or if you're too tired to continue, like the scene is unsafe, you need to move, or it's been a really long time, 20 minutes or more, and you haven't been able to get any help. So that would be in, a difficult situation, but maybe you were out hiking, camping in the woods, you're out somewhere remote, and for whatever reason, you can't get help with a phone or a person, or it takes a really long time. So let's pause there and check out a video. So 1 second. If you have any questions, this is a good time to check while I'm switching things around here. All right, here is our video.
Can you believe they're catching the game last night? It was amazing. I thought it was over. I was ready to turn the TV off and go to bed. But they got lucky. They had no business winning that game. Look, a win is a win. Yeah, right. Oh, check him out. That guy looks like he was out on the field. Seriously, though, you think he's okay? I would assume so, since he's out and about, but how can you tell? Hey, look, I gotta get to the office. Yeah, me too. Yeah. We'll get the documents over to your office later today, then we can discuss where to go from there. Sound good?
Help! Help! Dad, are you okay? Help! Dad. Help my dad, please.
Sir, are you okay? Sir, are you okay? Call 911. Get an AED and first aid kit right away.
Yeah, we have this at the store. Dad!
It's okay. He's calling 911. Did your father complain about anything before he collapsed? Or?
He was complaining about not feeling it, but he always complains, and then he just collapsed out of nowhere.
Do you know if he's allergic to anything?
Allergies. Aspirin. He's allergic to aspirin.
Does he take any medication? Or?
I don't think so.
All right. So that is a great intro for recognizing an emergency. And let's take a look at the CPR now, and then we'll review the details. There we go. Yes, there it is.
Hey, are you okay?
Confirming that someone is unresponsive.
Okay.
After confirming that someone is unresponsive and not breathing or only gasping, assume cardiac arrest and begin CPR.
He's unresponsive.
Ensure the person is on his back on a firm, flat surface such as the ground. Next, kneel beside him and place the heel of one hand in the center of his chest, with your other hand on top. Interlace your fingers and make sure they are up off the chest. Position your body so that your shoulders are directly over your hands. With this technique, you can use your body weight to help compress the chest. Now, give 30 chest compressions. Keeping your arms straight, push down at least 2 inches, then let the chest return to its normal position. Continue to push hard and fast, giving compressions at a rate of between 100 and 120 compressions per minute. Next, give 2 rescue breaths. First, place a breathing barrier over the person's nose and mouth. Then, open the airway by putting one hand on the forehead and 2 fingers on the bony part of the chin and tilting the head back to a pass neutral position. Pinch the nose shut, take a normal breath, and make a complete seal over the person's mouth with your mouth. Blow for about 1 second while looking to see that the chest rises. Take another breath, make a seal, and give a second rescue breath. Continue giving sets of 30 chest compressions and 2 rescue breaths until you notice an obvious sign of life. An AED is ready to use and no other trained responders are available. You have performed 5 sets of CPR and another trained responder is available to switch. EMS personnel take over. You are alone and too tired to continue, or the scene becomes unsafe.
All right, any questions on the CPR? We are going to go through each component in a little bit more detail here. Okay, for chest compressions, you are placing your hands on the center of that chest so that you can press that bone down and pump the heart. The rate is 100 to 120 compressions per minute. Us old people like to use the Staying Alive with our John Travolta song, so it's like a pretty good rate. It's pretty fast. The compression depth, no one is measuring here with the ruler. The whole point of this is that if our chest is this big, the person's laying on the ground, you know, we're trying to aim for 1/3, which means don't go halfway down, go less than that. So a very large person, you know, you're going to have to push harder. You're really going to be using your shoulders and getting on top of the chest when you're kneeling on the ground. Children, you know, smaller, less weight, and infants we're just using a few fingers and pushing down because it'll be very easy to push down. So just adjust that by how large the person is. Allow for complete chest recoil means if we are pushing down and then just kind of staying down here and pushing, that's not going to work. We have to push down and let it come back up the whole time. So like push up. So let it come back. That's what that means. Firm, flat surface means if someone collapses on a bed or a couch or anything like that, or even if you are in your spa chair that's reclined, we need to make that flat. Those are hard enough that if you just lay that back down, you know, you could do CPR on there, so it's up a little bit higher. If not, we need to put that person on the floor if they were in a waiting room or something like that and just kind of slumped over. And even outside, if someone is in a car accident, you do have to get them out of the car onto the ground before you do CPR. And our whole goal is to minimize interruption. So when we are checking for breathing, calling 911, putting on the AED pads, switching between rescue breaths and compressions, none of that should be more than 10 seconds. Once we hit 10 seconds, the oxygen starts leaving and going back, and we have to kind of start all over. So for rescue breaths, there are 2 methods. The one that you see in the videos is the head tilt, chin lift, and that's just what it says. Push back on the head and lift up the chin. We're just trying to open up this whole airway here so that it's really easy for air to go in and out. We use the jaw thrust if we suspect that someone has a head, neck, or spinal injury. So if they fell off of something or were in a car accident where the airbags went off, then we have to assume that they might have broken a bone, and any other movement of their neck can cause further injury. So we don't do that. Today, with our coronavirus, we are all using our masks. If someone does collapse and they weren't wearing a mask and they're still breathing, you could put a mask on them just so that they're not spreading any virus while they're unconscious. So you can make sure to have your surgical masks in your first aid kit, just so you don't have to carry them around with you. You saw on the video a little plastic that they put over a person's face. These are real easy to keep around. You can have like a keychain, and it's just literally this piece of plastic that you pull out, but it has a little filter section on it so that you're not breathing their air. So you can purchase these to put in a first aid kit. Also, I like just your Red Cross mask, and you see like lifeguards wearing these. They have a little belt clip on the back. These are real easy to use too. They come just flattened, and we need to pop it out. And the triangle part goes on the victim's nose like this. And then we're going to blow in the other side. So this is great because it's keeping me away from the person's mouth. I'm not going to put my mouth on somebody I don't know. And also there's a filter right inside here too that will keep the germs from coming back up. So I can blow in, but any air that comes out cannot come up into my face. So these are like $25, $30. So it's another good investment to have at your school or work so that you're not having to do any breaths on people you don't know. And again, that is your choice. We don't recommend doing, putting your mouth and blowing air on a stranger. There's just, of course, too many diseases these days. So you can choose to do that on a loved one or somebody you know and you're comfortable with if they would go unconscious and need rescue breaths. Otherwise, you should have one of these barriers around. You should have at least the plastic or a mask around so that you are not touching them. If you don't have that, you don't do breaths. If you don't know the person and you don't have a mask, you don't do breaths. So you don't stop at a car accident and do CPR and give breaths. You just do chest compressions. So you're going to do 2 breaths and watch for the chest to rise. If it doesn't rise, then you need to just switch the airway by kind of rotating it and see if you can reposition. Again, the interrupting, that's the same all the time. We're going to limit the interruptions. So next is the AED. So do you know what that stands for? We can impress our friends here. Automated external defibrillator. So very easy to use. They're scary looking if you haven't seen one. Now, if you have one at your school or where you're doing your clinicals or your practicals or whatever you're doing, please go look at it. Again, they look like scary. They're behind a glass, but you can just open that up and take these out and look at it. You should know how to turn it on. They all have a really obvious on button.
This is a training device.
And a lot of them are like different languages. Now I can do it in Spanish.
Este es un dispositivo de capacitación únicamente.
Okay, so you can check for languages on there. There are different size pads. So you're going to just look like these are pediatric, which are smaller than my adult ones. And they always have the pictures on here to tell you where to put it. So you really don't have to remember anything except turn it on. And it's going to tell you, put the pads on, make sure the cord is connected, push this button. It's going to tell you everything to do. Okay. So let's take a look at AED video. Anybody have any questions while I get that together?
For someone in cardiac arrest, calling 911 or the designated emergency number, starting CPR immediately, and using an AED as soon as possible gives the person the best chance for survival. Cardiac arrest can occur when the electrical impulses that cause the heart to contract rhythmically become abnormal, disorganized, and chaotic. The heart will stop beating or beat too ineffectively to circulate blood to the brain and other vital organs. Two abnormal heart rhythms in particular, ventricular fibrillation and ventricular tachycardia, can often be corrected by defibrillation, the electrical shock delivered by an AED. When effective, the shock disrupts the abnormal electrical activity long enough to allow the heart to spontaneously develop an effective rhythm on its own. An AED is simple to use. The device will guide you every step of the way. AEDs can be used on people of all ages and can also be used on pregnant women. All you need to do is turn the device on and follow the voice and visual prompts. Remember, start CPR immediately and use an AED as soon as possible. For each minute that CPR and AED use are delayed, the person's chance of survival is reduced by about 10%.
Right. Let's go back to, here we are. So we wanted to make sure to mention our eye injuries, and you've probably covered this already. Though if we're doing waxing near the eye, or even the chemicals, peels, and things like that, we don't suggest doing it if they have any wounds in that area. You need to make sure you're on clean, normal skin. So we're going to look at sunburn. When is it okay? When do you need to get medical attention? Because a sunburn is a 1st degree or 2nd degree burn. And the treatment is the same basically for any type of burn, is to have cold water on that right away. And if you can't get water, then even like an ice pack. If they've been using the retinols, then that will definitely cause more burning than you would expect. So they might look like they have normal skin, but that should be part of your intake, is to see what medications are on. Some antibiotics make you photosensitive also. And that means you can just go out in the sun and you think you're fine. And then 10 minutes later, you have a burn with bubbles on it, which is a 2nd degree burn. So we have to really just watch out for that. So let's take a look at burns. One second. Need to click the button. Here we go. So there's different types of burns, and you might be exposed to all of these in your type of work. Thermal is from heat, so that would be our waxing. And chemical, you're with your chemical peels, I think that can fall in that category. You might only be trying to put a small amount on a cotton swab or something like that, and then something happens and you dump the whole thing on their face. That's not a good situation. So with clothing, there's 2 different rules, because if we have chemical on the clothing, like it spilled on my face and on my clothes, you might be focused on washing and rinsing off the face, but then there's still chemical on my clothes. So it can go through the clothes, and now it's like burning the skin under my clothes. So that we actually want to get this off. That's going to be the best way to treat that. Now, a thermal burn, and think more like a campfire. If I fall accidentally into a campfire and burn my arm, the clothes can actually burn into the skin. They're kind of stuck to it. In that instance, you don't take that shirt off, because you could rip off like all of that skin that is stuck to it. So you do have to think of what the situation is. Chemical, if there is a powder or a liquid, you want to take that off of the person and just rinse everything with cool water and definitely call 911. If, again, you're going to touch it though, you have to put on gloves if you don't already have them on, because then it will get on your hands. An electrical burn, you want to think of, you know, hair dryer, curling iron, something like that, that would fall on someone. If it's quicker for you to pull it, the plug out, do that on your way to getting that off the person. But we have to remember not to touch someone. This is more like a big electrical thing, like an electrical wire falls on someone. You can't touch them or you're also going to get electrocuted. Let's see if I can get this to click. There. Okay. So we said cooling it as cold as possible. You do not want to use ice because that can cause frostbite. So you can have an ice pack, but it needs to be on a washcloth, and it's better to just have it be super cold, but not ice. Like just rinse a washcloth in cold water and you could put that on a small burn. That would feel good. If it actually bubbles, then we're going into second degree. So just redness is first degree. They're going to have redness and inflammation. Second degree, especially on the face, you're going to recommend that they need to get their doctor to look at it. If they're fine, like as far as walking around, they can drive themselves to the doctor. But even if we have like a small dime size burn, I've worked with lasers before too, with like laser hair removal, and you could definitely burn people if you had the wrong setting. And we, you know, I've unfortunately been through that before where I used to work. So if you see an immediate burn, you cool it, run cold water as long as you can, a cold wet washcloth, anything clean and sterile. And then if you have gauze, you're gonna just put some gauze on there. Nothing else should be put on it. They say plastic wrap. That's like a really severe situation. Like if you burned your whole arm in the campfire, you could wrap that in plastic wrap just to go to the hospital, but not to go home. So here's a little true or false. You can think of the answers here. Should we put ointment or butter on a burn? When I was growing up, my grandma used to put butter if you burned your finger on the stove. And so now we're saying, don't do that. It's actually going to trap heat in. So don't put any ointments on the burn. And we're so used to doing that. Now you can do the aloe. If you have like a soothing, healing, actual burn cream, you can put that on, but not just, you know, Neosporin or butter, something thick like petroleum, not like that. So is sunburn a thermal burn? It's actually radiation, which is interesting. And that's why it causes cancer, the more exposure that you have. So can an electrical burn cause cardiac arrest? Yes. That can, you know, if you're electrocuted, cause cardiac and respiratory arrest. Should we put ice on a burn? No. That will actually cause frostbite. Now they are talking about directly on the skin. You can use ice, like I said, if you have a barrier like a washcloth on there, but ice directly on the skin will cause frostbite. Monitor for shock. Yes, absolutely. So if it's a large area, they may go into shock. Okay, so a chemical that's powdered, should you flush it with cool running water? No, because what's going to happen there? If I have powder on my face that's burning and I wash it off, I'm just running that powder all over wherever the water goes. So try to move that away with a cloth or your gloves first, and then you can rinse it. Yes, we mentioned that one already. to cool any burn, we're using cool or cold water, not ice water. Okay. And let me just show you the other video. There we go. Here it is. So this is an ad for an eye wash station, and I hope that you have these in your school and workplace, because these are going to be very important when we are working with the face, especially around the eyes. So it doesn't matter what brand you have, but it's really great to have this sterile water, this green station that you see right here, and they're working with these chemicals. So I'll show you this. Oops, that is on super fast. Okay, there we go. Okay, so pretty easy. And the key point there is we should prepare for this and have something available. You want to have squeeze bottles. They have a station that's on the wall. When I go work at events, I always have an eye wash bottle or two in my kit. And it's just something that I can twist the cap off, and they either have those nice ones like you saw that's holding the eye open, or it just looks like kind of a saline bottle that you would have for contact lenses. But your whole point of that is to get them to tip back. And the thing to remember is we're squirting kind of towards the inside of whichever eye is being bothered, and we want the fluid to run out. Okay, so if I've hurt this eye, I'm not going to turn the head this way and run water down, because now whatever chemicals in this eye is now going in this eye. So that's the really only smart thing you need to think about, is which eye is it, and tip that one to the ground and then kind of hit the top of it and let it flow that way. And so even in that video, she was doing that even herself. You know, she was kind of just tipping her head a little bit so that it was just running down her face, which is fine. So we're just going to watch that it doesn't go into another eye that's not affected. If it's both, you just have to do one and then the other and go back and forth. So this can be even if somebody says they have something in their eye, like you're doing some sort of mascara or eyelash thing, or even waxing or peels or whatever you're doing. Chemical could get in, or even like a little piece of something. You all know how like just getting clumps of mascara in there like feels horrible. So you can have the eye wash and just kind of rinse it out. Now, all those bottles are like one use only. You know, once I open it and put that on somebody's eye, because it can be touching the eye, then, you know, you're throwing that out. And you should have more than one, but then that's how, you know, you were like, oh, I used this today, I need to order another one. And so Lori put a note here in the chat about where your eye wash stations are in. Okay, so that's really important to know, because this will be probably your most common injury, is somebody saying like, oh, this is burning, or, you know, on my skin, and you got to rinse it off, or something is in their eyes and they're saying, oh, something's in my eye. Okay, so that's the thing we want to remember there. And then let's go back and we'll finish up here. So let's see, we did that. So this is what you need to remember. If you can't remember anything else, is CPR, the most important thing is chest compressions. So again, we're just putting one hand right in the middle, put your other hand on top. It doesn't matter which way you do it. You can switch or find which way you like. That's really good to put those fingers together. And then you can see how they're kneeling and really putting your weight down and using your shoulders to push up and down, okay? And we're going to keep doing that until more help arrives, or you can switch with someone else if someone else can help you. And here's an overview of the whole entire thing. And please let me know if you have any questions. Yes, so the question was, are there smaller bottles of eye wash? Yes, like that one was a big one because that was somebody working in a lab with chemicals, but you know, you all work with chemicals too that can burn eyes. And you know, maybe like sort of this size is maybe the smallest I've seen them, because you really want to wash. You know, if you're washing for 15 minutes, you're going to use that whole bottle. So that if I really put a bad chemical in my eye, I'm going to wash for 15 minutes. If you just got some of your mask material into an eye, then it can be, you know, smaller. But you're gonna use like a whole bottle of saline. And if saline is better and sterile water and distilled water is better, but you can use tap water if you have to. That's just not as clean. It does have some chemicals on it. So allergic reaction in the eye, there's a question about that. Now we don't rinse allergies, and if we're having an allergy, that would be both eyes would be red, and I would be getting hives and a rash and itching. So that's like an all over reaction. We don't have to rinse the eyes there. If we're having an allergic reaction in one eye, like one eye is red and bothering that person, then I would rinse that out, because that means something got in there. Doesn't really matter if they're allergic to that or not. It's in there and we need to get it out. Yes, so bleeding from the head and not breathing normally, yeah, you do CPR. I didn't mention bleeding really, but if there's any hemorrhaging, like somebody was in some sort of horrible accident, if they are hemorrhaging, like spurting blood, or blood is just spreading so fast on the ground, you do have to find that and put pressure on it. And we just use any clean material that we have and hold our hands right on it. And it would not be effective to do CPR while someone was hemorrhaging, because if I'm pushing their heart and pumping their blood and their arm was amputated, it's just going to squirt out on the end. So those two do not work at the same time. But what we can do is if it's something that we can put a tourniquet on, or there's another person that's able to hold the pressure on there, then yes, somebody else could do CPR. But so bleeding from the head does not usually get hemorrhaging. It's like, you know, a cut on the head. So those are not things that if I'm doing CPR, it's not going to spurt out. Heads bleed a lot, but they're not from arteries. So I hope that answered your question. Here's my name again, Kim Murray, and there is my email, and I can send that to, you know, Lori has all that. If you ever have any medical question, you can ask me. So here is another question about chest compressions if you do it wrong. So that means, I mentioned that in the beginning, the Good Samaritan law, if you're a bystander and you're attempting to do CPR just from what you learned in the last hour, then no, you can't hurt them. You could break a rib, and if you do it wrong and it doesn't work, you're not at fault for that. You're trying to help them. So about the bleeding again, if it's there is a difference. If you're hemorrhaging, which means it has to be squirting out at like the rate of the pulse, and that means their heart's still beating, you do have to stop that. They're not, it's weird to think about, but they're not going to hemorrhage if their heart's not beating, if you can understand that, because their heart is not pushing that blood out, and blood does not, it'll ooze out, but it's not going to spurt out. So if you see spurting, or like we do see on TV, if somebody's shot and then they have like blood just coming out so fast you can't even look at it, then we do need to stop that bleeding and find it and put pressure on it. And so you are going to need 2 people at that point if there's a lot of bleeding, because somebody's going to have to work on holding pressure and somebody's going to have to do CPR. And yeah, if you're the only person, you do the bleeding first before chest compressions. So for CPR for the babies and kids, I kind of skipped by it, but let's see where that is. The only difference right here is we do more, the ratio is faster, 15 chest compressions with 2 rescue breaths. And with adults, this is the adult one, it's 30 and 2. So it's not that different. And it's not going to be that big of a deal if you do the wrong ratio, because our whole point is just chest compressions. Like, don't worry about the breaths as much. Yes, and CPR certification is good for 2 years, and that's international. We do have international people taking it also. So let me show you how to do this. We are going to go to this website. I had mentioned our Save a Life initiative, and we are hosted by this NHCPS, which is National Healthcare Provider Systems. And again, I am going to send all of this information to Lori with the links and the code, so you don't have to copy it down now, and she can forward that to everybody. Oops, I just sent that to the wrong person. There we go. I meant to send that to everybody. And you're going to go to CPR and click on that. And then when you go to your cart and check out, and you guys all know how to do this because you shop online. I just want to show you because it's down in the middle. Click here to enter your code. And we're using this DF, so it's Disc Foundation CPR Web 100. And once I hit apply, you're going to see that it comes down to 0. Okay, so this is how you do it for free. You're going to pick CPR. There is also a bloodborne pathogens, which is all the virus and infectious things. If that's something that you like to learn more about, you can take that one also. All the free resources are here. So there's lots of good quizzes and tests, and you can come back to this at any time. So then if I'm taking CPR, just to show you, we have all these modules. So we only talked about the eye injuries and the burns. So there's other first aid issues. The choking is in here, and all of the CPR and AED. And then there's videos for everything. And then you can take the exam, and you do have to get an 80% to pass and be certified, but you can take that as many times as you want. And so it will rotate the questions, but you could look up something that you didn't get correct and go review that and take it again. Any other questions? Yes, you can get certified again if you've already had CPR certification, or even if yours isn't expired, you can go do the course for free. That's fine, not a problem. Let's see, the bones are broken. Bones aren't going to matter with CPR. So you can go through and find some of the answers here in the traumatic injuries part. So this talks more about bleeding and tourniquets and just different types of injuries, spine, bone, joint, all that kind of stuff. So all of that is in here. But our main concern is if a bone is sticking out, like an arm or a leg, you fell off a cliff or something, that's not going to matter. Don't touch it. Just leave it there. Don't try to put it back. Call for help. And if they need CPR, you're going to do CPR and just ignore that broken arm or leg. If we think they have a broken neck or back, you don't move them at all. And it's good to have somebody hold them, even if they're unconscious, so that they don't wiggle at all or move during CPR. Don't move them. And so that's an important rule. Like anytime in a car accident or a diving accident or swimming or drowning or whatever, we're not going to move the person at all unless they need CPR and they're in a position that they can't do it. Because if they need CPR and we don't move them, they are going to die. So at that point, you have to consider it's better to move them to a flat surface and start CPR so that they can survive the incident. So for epilepsy, we don't need to do CPR. For epilepsy, that is seizures and somebody that has a history of seizures. So when people have seizures, sometimes they stop breathing, but usually a seizure is less than a few minutes. So some people don't even call 911 when they have seizures. Like if you have a roommate, I know my daughter had a roommate once that had epilepsy, and if he had a seizure, we wouldn't call 911 because that would be just more hospital bills for them. So yeah, if they don't get hurt and they breathe, then they're fine. You just sit with them until it's over and then, you know, help them. But yes, if they stop breathing, which it's really hard to tell when they're having a seizure, but basically if it goes more than 15 minutes, we use 15 minutes for a lot of our rules. If they have a seizure more than 15 minutes, or if they have the seizure and it stops and then they're not breathing, then yes, you do CPR and treat them like anybody that is doing CPR. So if you do have like a friend, a coworker with epilepsy, it's just good to talk to them about it ahead of time and say, hey, what do you want me to do when you have a seizure? Do you want me to call 911 or not? You know. Any other questions I can help you with? Yeah, these are really good questions. Okay, so we really went through this really quick overview with some videos, but I talked about some eye wash and some burn information. So just keep learning about that. Go on to the website and you can take the whole course whenever you have time with your free code. And I want you all to get certified in CPR. And I'm happy to do this again. If you guys want to do it every year or every semester or whatever you want to do, we can talk about different topics. And I will email Lori all the links and codes so she can send that out to everybody so that you can use it. Okay. Any other questions? We good? All right. Well, thank you very much.